Ladies and gentlemen, dear colleagues, the COVID-19 pandemic is a challenge to humanity. Prevention and treatment of the new coronavirus infection and its severe pulmonary complications is a current and unsolved problem worldwide. The key features of a pandemic are high contagiosity of a new coronavirus infection, the absence of etiologic treatment, and outcomes in severe bilateral pneumonia with the development of acute respiratory distress syndrome and sepsis. The features of COVID pathogenesis. The entrance gate of the pathogen is the epithelium of the upper respiratory tract and the epitheliocytes of the stomach and intestines. The initial step of infection is the penetration of SARS-CoV-2 into target cells with angiotensin converting enzyme type 2 receptors. Intracellular viral replication and lymphohematogenic dissemination is characteristic feature. In severe course of COVID-19, severe respiratory failure develops with the clinic of diffuse alveolar damage, endotheliitis, and alveolar hemorrhagic syndrome. The board of the Union of Medical Biophotonics Specialists on March 23, 2020 declared to approve the initiative working group to develop annotation of the research work on the topic investigation of the effectiveness of photodynamic inactivation of SARS-CoV-2. Photodynamic therapy requires three components: light energy, a photosensitizer substance, and oxygen. PDT is based on a photochemical reaction under which light energy interacts with the light-sensitive drug photosensitizers, turning them into an excited triplet state, returning from which to a stable state is accompanied with the energy transfer to oxygen molecules dissolved in tissues, converting them into toxic radicals. It is the oxygen radicals that can kill cancer cells and bacteria and irreversibly damage viral structures such as spikes, envelope, and genetic material. On this basis, we declared the concept of anti-COVID prophylaxis and treatment. It is based on technology of photodynamic therapy, which includes multimodal application of drug photosensitizers and light energy in the visible red range, aimed at damage S protein of SARS-CoV-2, its envelope structures, and irreversible destruction of genetic material of the virus, blocking the replication of viruses in the human body, and immune-mediated prevention and treatment of cytokine storm in the human body by photochemoimmunotherapy with formation of anti-inflammatory immune response. Investigation of the effectiveness of photodynamic inactivation of SARS-CoV-2 in vitro and in vivo will be demonstrated in my presentation. Firstly, experimental evaluation of the efficacy of PDT of SARS-CoV-2 in vitro had a purpose to evaluate the antiviral activity of the drug photosensitizers methylene blue and chlorine E6 radachlorine for inactivation of SARS-CoV-2 viral suspensions and for photodynamic therapy of coronavirus infected transplanted Vero E6 cells. Materials and methods of this investigation. We had a BCL3 level virology laboratory certified to handle pathogenic biological agents of hazard group number 2. We had viral strands of SARS-CoV-2 collection from the State Research Center Vector. Cultivation of the virus in the Vera ESL's green monkey kidney sand model layer was performed. The photosensitizers methylene blue and radichlorine were diluted in IGLA medium in micro and nanomolar concentrations. And we used semiconductor laser with wavelength 662 nanometer and output power 340 milliwatt. Photodynamic inactivation of SARS-CoV-2 viral suspensions took place in the presence of extremely low doses of radichlorine in the concentration range from 500 to 5/10 micrograms at dose densities of 16 and 40 joule per square centimeter of light energy. Complete inactivation of SARS-CoV-2 at a titer 10 to the third power of cytopathogenic dose of SARS-CoV-2 was recorded. Radichlorine at such low doses without light energy did not induce virus inactivation, as you see on this table. Also, photodynamic treatment of SARS-CoV-2 suspensions in the presence of extremely low doses of methylene blue in the concentrations from 1/1000th of a percent to 1/10,000th of a percent completely inactivates the infection activity of 10 to the third power of cytopathogenic dose of SARS-CoV-2. On the next stage of our investigation, we performed evaluation of PDT effects on SARS-CoV-2 replication in infected cells. We used Vero E6 cell monolayers that were infected with SARS-CoV-2 virus in infectious titers, and then photosensitizers, methylene blue or radichlorine in various concentrations were added and PDT was performed. As you see on this slide, 2 days after infection and PDT, complete inhibition of viral replication was recorded. So, PDT of SARS-CoV-2 infected cells using methylene blue and radichlorine effectively inhibits viral replication and protects cells from lysis. Also, PDT reduces SARS-CoV-2 infectivity in suspension by a 1000-fold during 40-100 seconds. And when using these photosensibilizers 3.5 hours after infecting the cells, therapeutic indexes were between 25 and 150. It was necessary to study the possibility of light transmittance of the respiratory system in order to activate photodynamic reaction in the respiratory tract. Irradiation in the red spectral range of 660 nanometers provides photodynamic inactivation of the infection wherever the photosensitizer is located and wherever light penetrates. We evaluated the light conducting properties of the trachea. We used this red energy. It was delivered to the lumen of the trachea from a laser generator through light guide at a power 420 milliwatts. And at the distal aperture of the trachea, the light energy is 160 milliwatts. We have shown that non-invasive PDT of the upper airways using a quartz light guide allows light to reach the distal part of trachea through the open vocal slit during each inspiration. So it was possible to develop and manufacture the light therapy device. We performed photonic mini for lead prevention and treatment of COVID-19 by PDT. Now we can demonstrate our proposed techniques for prevention and treatment of COVID-19 by local photosensitization procedures and PDT of respiratory system. As if methylene blue and chlorine E6 are promising for prevention and therapy of COVID-19, it is the possibility of introducing these drugs into the patient's body by irrigation or washing of the upper respiratory tract mucosa and their inhalation delivery in the form of aerosols to the lower airways allows inactivating SARS coronavirus by red light and inhibiting its replication in the tracheobronchial tree and lungs, which is promising for COVID-19 prevention and therapy. We performed clinical validation of PDT in COVID-19 prevention among healthcare workers. It was a pilot study. Prophylactic anti-COVID PDT consists of 2 daily treatments. The first procedure is performed before entering an area with an increased epidemiological risk of infection. The use of personal protective equipment such as face masks, rubber gloves, goggles in crowded places is not abolished. And second PDT procedure is performed after returning from an epidemiologically unfavorable territory. During the 6 months of the pandemic from April 15 to October 15, 2020, none of the 100 healthcare workers tested fell ill with COVID-19, although viral infection of non-sick carriers was detected by PCR in 2% of cases, and asymptomatic self-healing was confirmed by a formation of antiviral immunity in 10% of observations. We also performed clinical testing of COVID-19 outbreak prophylaxis among patients in the Novosibirsk State Regional Clinical Tuberculosis Hospital. From April to November 2021, 6 hospital-acquired COVID-19 episodes were detected in 10 patients from surgical and physiatric departments. The total number of patients in close long-term contact with infectious patients without face masks was 199. Prophylactic daily use of methylene blue 10 mg in the form of nasal instillations, oropharyngeal irrigations and oral intake for 10 days and PDT of the nasopharynx prevented new cases with COVID-19 in all these patients. It was also performed a pilot clinical study of the effectiveness of outpatient PDT for COVID-19. We performed a distant follow-up by WhatsApp of 50 outpatients who had the onset of the disease, performed inhalation, nasopharyngeal irrigation and oral administration of methylene blue at a dose of 10 mg per day, followed by lead PDT procedures for 10 days on their own. Treatment resulted in a low symptomatic, mild and occasionally moderate to severe course of the disease. No one was hospitalized. In 76.5% of cases, within 3 days, fever, anosmia, and asthenia were gone. Viral pneumonias were prevented in 25%, and in the remaining 75% of cases, complete reversibility of viral lung lesions was documented by CT scan. Seronegativation of smears occurred from 3 to 14 days. We used laser-led set of equipment, nebulizer and drug photosynthesizer for prevention and treatment of new coronavirus infections that was demonstrated on this slide. PDT for COVID pneumonias with percutaneous delivery of light energy is demonstrated on these pictures. The method is based on the ability of tissues of the trachea and chest wall to transmit light energy of the red range. Lead energy is able to penetrate through the chest wall and induce antimicrobial, antiviral, anti-inflammatory and antifibrotic reactions in the photosensitized lung and pleura. PDT is percutaneously applied through the light fields generated by matrix emitters for 10 minutes per each field at an energy density of 195 milliwatt per square centimeter. Total dose per field is about 3000 joules. The duration of an lead PDT session for bilateral pneumonia takes from 60 to 80 minutes. As an example, we demonstrate the patient 40 years old during lead PDT procedure for COVID pneumonia and pneumofibrosis. The same patient demonstrate the impressive computer tomograph dynamics of anti-inflammatory, resolving and antifibrotic effects of PDT after 3 treatments. We also demonstrate clinical example of outpatient PDT for severe bilateral subtotal viral pneumonia. After treatment, 26 days after the beginning of treatment, we receive very impressive resolution of inflammation and pulmonary infiltration in lungs and rehabilitation of respiratory failure in this patient. So, patients who received PDT for coronavirus pneumonias give high subjective evaluation of the treatment results from the first day of the start of the therapy. Subjective data are confirmed by favorable clinical, radiological, and functional changes in the respiratory organs. Laboratory control confirmed reduction of markers of virus-induced inflammatory process. Also, we had rapid smear seronegativation. In the conclusion, we can declare that the developed concept of anti-COVID photodynamic therapy based on a multimodal application of pharmaceutical phenothiazines and porphyrins is confirmed by successful pilot clinical trials of prevention and treatment of COVID-19. PDT demonstrates the etiopathogenetic orientation of the developed modalities of action on the respiratory organs. Anti-COVID PDT can significantly impact the reduction of mobility and mortality from COVID-19. Thank you very much for your attention.